Hello, I'm Mallie Shansfeld, Managing Editor of Implant Practice US, a MedMark publication. Welcome to a live presentation and question and answer with Dr. Ernest Cholakis. During this webinar presentation, the basic principles of owning and operating a successful dental implant practice will be discussed. Insights will be given about purposeful marketing strategies that will attract new patients and keep your practice thriving in the digital age. Before we get started, I would like to invite viewers to use the question box in your control panel to ask any questions, and your questions will be answered via email at the end of the session. Winnipeg dentist Dr. Ernest Cholakis obtained his DMD in 1982 from the University of Manitoba. He had attended the very first university-based aesthetic curriculum at Chase Western Reserve University in 1992, and followed that up with a continuing education certificate in cosmetic dentistry from UCLA in 1998. Following this, he attended the Misch Institute program in implant dentistry at the University of Pittsburgh. Dr. Cholakis received his fellowship in the International College of Oral Implantology in 1996. Since that time, Dr. Cholakis has placed and restored thousands of dental implants, making him one of Winnipeg's most experienced dentists in placing and restoring dental implants. In 2003, Dr. Cholakis graduated from the University of Chicago Booth School of Business with an MBA. These degrees were influential in the conception and development of the Cholakis Dental Group. Dr. Cholakis, we turn the webinar over to you to learn more about the topic for today.
Mallie, thank you. I'm delighted to be here. My presentation today is Back to Basics, Practice Management 101. And my first slide is that everything we do is marketing. How we present ourselves, how we present our office, how our staff interacts with patients, everything is about marketing. And in this era, in today's world, quality service is paramount. It's not the work that a patient can necessarily perceive to be good or bad, but what they can perceive, logical or illogical, is the quality of the service. And it occurs due to the ambiguity that surrounds technical excellence and the difficulty that the patient has in appraising it. But what they do know for sure is whether the operator, the doctor, has a genuine interest in their well-being and whether they're being cared for in an honorable manner. So the question is, why do some dentists command enduring patient loyalty? Their telephones never stop ringing, while other practitioners are treated like commodities, challenged on their fees, always in need of patience. The question is, where do we start? And the first rule that I'd like to share with you is, of course, something that everyone has heard. You get one chance to make a first impression. But this begins well before you meet the patient for the first time. It really begins with your reputation and your preparation. Think of it as your brand. A brand is the trust that you convey to your society, to your neighborhood, to your patients. You build trust by making bold promises and delivering it. Each and every dentist is a brand. Lincoln, a brand that we trust. You build trust by making a bold promise and delivering it. As I said, you are the brand. The question is, what brand is tattooed on you? Who will you be? What will you represent? What are your values? What is the culture that you will engender in your practice? At the Mayo Clinic, they understand the importance of a real promise and they deliver it one patient at a time. In fact, their mission statement states, putting the needs of the patient first. And at this institution, everyone is empowered to live the brand. Another brand promise with exceptional profile and integrity in the industry is Carestream Dental. They are a leading technology provider, one of the 50 most promising healthcare companies and solution providers in the world. A promise is the heart and soul of any organization. It encompasses your marketing programs, your management, your strategies, and it sets the tone and direction for everything the firm does. Take a look at MD Anderson. What is their mantra? It's making cancer history. So between the institutions of the Mayo Clinic, MD Anderson, people are beating a path to their door. Think of Rochester, Minnesota, not New York, not London, not Paris, Rochester, and yet in 2018, the Mayo Clinic had sales revenues of over $12 billion, and their net income was over $4 billion. Why? Are they begging patients to come to their clinic? Absolutely not. It's based on the belief that this is an institution that can provide the very best of care. And they do it by preaching a cooperative science of interdisciplinary care. And as a dental profession, we can learn a lot from that. As a practice and as individuals, we make big commitments to our patients and to our team. We have a passion for making a difference in the lives of those we serve and for our staff members that dedicate their services to others. This is our mission at Cholakis Dental Group, and I invite you to take it if it speaks to you. Perception is reality. It doesn't matter what you think. What's important is what the patient thinks. And the expectancy theory states that if your mind expects something to happen, it will. If you expect a rash from a plant or pain, guess what? You will get it. We experience what we believe we will experience. This means that anything and everything a service can do to convey quality, expertise, the ability to perform well will likely enhance patient satisfaction. Take, for example, Folgers coffee. Years ago, it was a commodity-based, freeze-dried, artificially preserved product that was stuffed in a glass jar and sold as instant coffee. But sold and presented in highly reputable restaurants had guests savoring their instant cups of coffee. Take a look at this advertisement from the early 60s.
World-famous Arno's restaurant. We secretly replaced the fine coffee they normally serve with Folgers crystals. Are dark, sparkling Folgers crystals rich enough to top off a fabulous meal? Watch.
Do you have more? I mean, it's delicious.
And a good, rich body and flavor.
It was Folgers crystals.
I don't believe.
Oh, no. You mean instant? I would serve it at home because it's delicious.
I'd like another cup.
Folgers crystals. Coffee rich enough to be served in America's finest restaurants.
What is the moral here? The moral is expectancy theory. Expect something to be good, and you will be looking for hints and clues to substantiate that. The coffee was borrowing from the strength of the brand of the restaurant with excellent service, a maitre d', coffee served in fine English bone china, all lent to the experience and the expectation that the coffee was going to be superb. And honestly, for the patrons who had the coffee, it was superb. Take a look at this slide. Tiffany, what do people expect in this blue box? Wouldn't it be wonderful if patients came to your office and expected a blue box experience before they even met you? This is the brand that I think all of us should try to achieve. Daniel Kahneman, the author of the expectancy theory and a winner of the Nobel Prize, states, or shall I say, let me irradiate on his behalf, make your patients believe that they will be utterly delighted, and while they will be, especially if you do it with a plan that addresses being good and looking good. What does this mean? It means if you go in there demonstrating your passion for the profession, and you have tangible clues like excellent technology, and the technology that I'm thinking is a cone beam CAT scan like CareStream, We've had the Carestream 9000, the 9300, and now we're looking forward to the latest model. And when you have tangible clues that signal quality in your commitment, guess what? The patient's expectation is elevated. And when it is elevated, they're looking for confirmation of that bias. So it's important when you are assessing your operation, your practice, to think and walk in the shoes of your patient. And patient experiences are based on the following perceptions: reliability, that speaks to dependability and accuracy; assurance, trust and confidence; responsiveness, promptness of service; empathy, which is personal care and attention; and presentation, which is the appearance of facilities and personnel. And what is interesting is that 4 of these elements utilize technology. And so the idea of technology and its incorporation in your clinic and in your day-to-day work is very important. I want to bring to your attention that reliability represents the largest segment of a patient's perception, almost 1/3. It's about dependability and accuracy. And this speaks to our need for dependable radiography. It speaks to the importance of having a cone beam if you are placing implants. It speaks to the importance of having a digital scanner so that you can combine the STL file with the DICOM to be able to create a surgical guide. All of these things speak to reliability. They speak to the trust and confidence or assurance that the patient has in you. And responsiveness really speaks to the follow-up. Did you provide that summary letter the very same day that you saw the patient? This is critical. Of these 5 dimensions, as I said, reliability is the most important dimension in meeting customer expectations, whereas the process dimensions, i.e. the dimensions that involve getting the work done, speak to assurance and responsiveness and empathy, are most important in exceeding customer expectations. With process dimensions, there is an opportunity to surprise your patients with uncommon swiftness, with graciousness, with courtesy, competence, commitment, or understanding, and just simply going beyond the patient's expectations. So, my second rule is make it easy for patients to say yes. You can do this by demonstrating your commitment to exceptional patient care through technology and your personal training, the courses that you take throughout your career. When you invest in yourself and your practice, you are subtly sending a message to your patients that they should invest in you. Think of the physical appearance of your clinic, the equipment, the technology that you utilize, the personnel that you have surrounding you, and your marketing materials. Take a look at the CS 1500 here, an intraoral camera. Not the most advanced technology, but in this case here, this product by Carestream is extremely compelling. Take a look at this video of one of our young associate doctors supplying a video on Facebook and Instagram with amazing reception in the community. Just take a look.
Hey, hi, I'm Dr. Cholakis, and here at InStyle, I'd like to introduce you to one of our great technologies. I have here an intraoral camera, Carestream intraoral camera that we use to help us with some diagnosing and for patient information. I'd like to show you how this works. So what we have here is an x-ray, a standard x-ray that we take to give us an idea of what cavities we have in the mouth. And in this particular patient's case, they have an old amalgam filling here, a silver filling, and we are unable to see what's really going on. But with our intraoral camera, we take a picture inside the mouth, and then you can see a little more clearly what's actually going on. So here you can see that this is that same filling. However, half the tooth here has been broken off. So we get a little bit more information and something that we get to show you hands-on, specifically what's going on in your mouth.
Simple. As I said, everything is marketing. And this insertion in our Facebook and in our Instagram accounts really provoked a lot of interest. So really, what we're asking of our patients is to employ us. And so the rule number 3 that I try to live by is better late and right than early and wrong. Often we rush to conclusions. Often we rush to render treatment and care without not fully thinking of all of the ramifications. And what I'm thinking about here is something that is really ingrained in us as a form of human nature. And that is that as human beings, we tend to focus on short-term gains and discount long-term costs. And this comes back to bite us. So it's very important to study your cases and collaborate with colleagues before presenting treatment plans. Comprehensive records are a must because this speaks to your reliability, one of the factors that patients are scanning for. And so when I think of CareStream, I think of all of their record management software, the fact that you can access your bite wings, your periapicals, your panorex, your photograph, your digital scans, and your CT scans all in one repository. And the fact that all of this information can be collated and utilized for studies is tremendous. And I can't think of another vendor that does that so seamlessly than CareStream. So in our clinic, we have the CS9300, we have the CS9000. We're looking forward to the new CS system that just came up. And what this allows us to do is 2D with a pan, 3D when we're studying, in this example, periapical pathology, implant placement. And then when we're merging files, when we're merging the digital scan with the cone beam scan to make a representation for 3D planning, for the fabrication of templates, and for the fabrication and the design of final prosthesis, again, in our minds, a technology second to none. So marketing is really an invitation, isn't it? And that brings us to rule number 4. Bid to win by telling a service story in the most compelling way. Successful organizations noted for distinctive service tell their stories effectively through systematic clue management. In other words, you want, when you give the patient your treatment plan, to create it in such a way that they're not pushed to say yes, but that they're compelled, they're pulled to say yes, because they realize that the value proposition that you're offering exceeds the price or the cost of your treatment. Let's look again at the Mayo Clinic, an institution that was started in the early 1900s, an institution that founded the chart, an institution that was an early adopter of the electronic chart, an institution that pioneered interdisciplinary care. What have they arrived after all these years? Well, they look at 3 categories. The first category that they constantly scan is the functional clue category. It speaks to technical quality of the service, its reliability and functionality. So anything that influences the impressions of technical quality by absence or presence. I think of technology here. Why is technology so important? Because it is a substitution for human error. The more that you can get technology to do, the less likely you will have errors. Take a look at the airline industry. 10,000 errors are committed by the airline industry, but because they are of a minor nature, because they rely on systematization of everything they do in technology, no airline crashes, no airplanes falling from the sky. By comparison, in the healthcare industry, in hospitals, if the airline industry had the same error rate as what is found in the United States and Canada for hospitals, it is said that an airplane would fall out of the sky every other day. What is the difference? It's the absence of systematic approaches and technology. So is technology critical to the success of your practice? Yes. Let's look at mechanic clues. They come from inanimate objects and include sights, smells, sounds, tastes, and textures. I'm thinking of facilities, your equipment, the furniture, the displays, the lighting, and other sensory clues offer a visual presentation of the service, communicating volumes without words. In other words, it's not necessary that the patient consciously recognizes everything, but subconsciously, all of this information is embedded in the patient's mind. And so when you have technology and it's designed in a way that looks futuristic, that looks like it is ultra modern, you are communicating again volumes to your patient. And finally, the third clue that the Mayo Clinic identifies as extremely important is humanic. Clues from the behavior and appearance of your service providers. For example, their verbal and body language, their tone of voice, the level of enthusiasm in their voice, and the appropriateness of dress. This is absolutely important. So, while functional clues concern the what of the service, experience and mechanic and humanic concern the how. Functional clues primarily influence rational perceptions, i.e. the logical perceptions of what has occurred, but mechanic and humanic influence emotional perceptions that are often more powerful in determining the patient's perception of you as a doctor and of your clinic. So in summary, functional is instilling confidence by demonstrating competence. Mechanic is about first impressions, expectations, and your value proposition. And humanic is about exceeding expectations. How can you do that on a day in and day out basis? Simple. You see the patient for an exam, you have a summary letter sent to them, emailed that very night. And when you perform a procedure like a crown or an extraction or an implant, you phone that night to see how they're doing. This every time exceeds their expectations. So according to Harry Beckwith, the author of the book, The Invisible Touch, if your goal is satisfied clients, your goal is far too modest. Satisfied clients do not help your business, and very satisfied clients only help a little. What you need and want are delighted patients because they volunteer references by taking time from their busy lives to write and thank you for it. Let me give you a small example. Enterprise Car Rental was the new kid on the block 50 years ago. They were started out of the founder's garage, but he knew something about people. And so he hired college graduates to run his offices. And he had a customer survey. This customer survey only had 2 questions. Out of 5 stars, how did you rate your experience? Question number 2, out of 5 stars, would you refer a family member or friend to this business? And if each one of those outcomes was a 5-star, that customer would get a letter of thanks because it acknowledged what they had said And in a way, it reinforced the fact that they would refer another customer. And this is what all of us should be doing for each and every one of our patients. So in conclusion, doctors, dentists, we are not in the tooth business. We're not in the dental business. We are in the people business. And making a great first impression with your patients by showcasing your technology and using that technology to make it easier for your patients to say yes, that commits to accuracy, safety, and predictable outcomes, and founding all of this reliable digital platform and proper training are truly the simple truths that lead to success. I'd like to say thank you.
Thank you so much, Dr. Cholakis. That was a very, very informative webinar. I do have some questions, but before I get to those, I would again like to invite viewers to use the question box in your control panel to ask any questions that you have. My first question to you here is, can you review some of the types of technology that I can use, that I can implement to boost my reputation if I have not yet implemented technologies?
I think that, of course, diagnostic technology is critical. So digital radiography, a cone beam, intraoral camera, a digital scanner are all critical pieces of technology that one really needs to incorporate in their practices. Why? Because the journey begins with the first step. The first step is diagnosis. And so really, we need to be expert diagnosticians. Thoroughly review a patient's problem and really showcase our knowledge. Then the superfluous part is really the treatment planning. The patient already wants you to cut to the chase because they know they need and want treatment. But it begins on the foundation of diagnosis.
Okay, thank you. Another question. Should my technology be the main focus of my marketing to patients?
No, I think the main focus is you as an individual. What is your mission? What is your vision for the future? What are your values? What is the culture that you will instill in your practice? I think that as an individual doctor, you are the most important aspect of your brand. Should your brand also include technology? Should your brand present yourself as being modern and forward-thinking? I think there's serious benefit to that.
Great. Third question here. How often should I post to social media? How much is too much information?
There's an old marketing adage, better to be looked over than overlooked. And so we post almost every other day, sometimes twice a day. We have in our clinic a social media manager. We also have our own graphic designer. Now, it wasn't always like that, but now that we run multiple clinics and we care for over 28,000 patients, we have to systematize what we're doing. As we get bigger, the reliance on technology is more and more important. But I think it's also important if you're a solo practitioner, because you have to compete in the marketplace. And there are all kinds of vendors that are there to help you. CareStream is one that comes to mind.
Okay. Should there be a designated social media manager in the office, or can someone have double duties on assisting or being front office and social media?
I think so. I think that you can have a staff member if they are trained. And there are all kinds of courses provided in the dental profession and in community colleges about social media. Because there has to be some level of training and understanding as far as what is appropriate, what is not appropriate. having the patient's consent if you're going to use their likeness or their cases. So some training is required, but I would recommend that it would be very easy for someone within the practice, whether it's an assistant, a hygienist, an administrator, receptionist, to be in charge of that facet. Absolutely. And the more personalized you make it, the more genuine it reads in society, and the more compelling it typically is.
Okay. When you post those videos to your marketing, can you use a cell phone to film, or you need some more professional equipment for that?
We sometimes use a cell phone, and we sometimes use more sophisticated equipment. It just depends. Is it something that is spontaneous, the spur of the moment, or is it something that we've spent a little time thinking about?
Does every patient sign a release that they could be used on media or marketing, or just when you see that they've done something specific that you want to put on?
Can you repeat the question? I'm sorry, I didn't hear
Does every patient sign a release for marketing?
Absolutely. Every patient has to sign a consent form because, again, we're talking about patient confidentiality. Just the identity of a patient being presented in your office, that's confidential. And so you need their authority, you need their permission to represent you in that regard.
Okay, if I am new to marketing my practice, how much or what portion of my budget, monthly or annually, should I be devoting to marketing pursuits?
Between 3 and 5% of your gross revenue.
Okay. Okay. Can you tell us what some of your favorite technologies are for avoiding? You were talking about avoiding clinical errors. Can you review some of your favorite technologies for avoiding clinical errors and wowing those patients?
Absolutely. So we want to avoid errors. So a large part of my practice is dental implantology. And so we do not perform any kind of treatment without a cone beam scan. Why? We're looking for critical structures. We're looking for adjacent pathology. We're looking for anything that we don't expect, like a tumor, like cancer. We're looking at the shape of the sinus. We're looking for limiting factors. So when we are better apprised of the anatomy of the area that we're working on, and that we can satisfy ourselves that there isn't pathology in that area or anywhere that the scan gives us a representation of, we are already limiting our liability to error.
So you use the 3D imaging to teach the patients what you know and how you know it?
Yes. I mean, think about it. You can take a CBCT scan, that's a DICOM file. You can then use your CS3600, do a digital scan. You can combine the two, you can merge the two files. You can make a surgical template. And already you've cut out so much potential error because now you're using a surgical guide that has an abundance of information embedded in it.
Not every implant dentist uses CBCT technology, so would you use that as a centerpiece of your technology, since other dentists may have other digital imaging, but not everyone has that sort of high-level technology?
I believe that we're approaching it as a standard of care. It's really a standard of care. I believe that our profession, it should, if not, we've already recognized that it is a standard of care. And I think that if I'm a young practitioner and I don't have the funds for a cone beam, I can certainly have the wherewithal to refer my patient to a colleague that has a cone beam so that they can take the cone beam for me, and then I can have the benefits of reading that cone beam. the patient needs that critical information so that they have the best chance, the best likelihood of a good outcome. Battles are won before they're fought. Battles are won with good planning. Planning comes from diagnosis. And so you need a cone beam. And not having the machine in your office is still not an excuse. You just simply refer the patient to a radiology center or a colleague, and you have that information at your fingertips.
Very interesting, informative. We have run out of time today. So if I did not get to someone's question, we will answer it after the webinar via email. We would like to thank you all for attending, and a very special thank you to Dr. Cholakis and our sponsor for this webinar, Carestream Dental. Thank you and have a good evening.
It was a delight. Thank you.
Thank you. Bye-bye.